Good afternoon. Thanks for joining us for the news at 4. I'm Morgan Romero. Crisis standards of care is no longer in effect in Idaho. That came out of today's Idaho Department of Health and Welfare weekly COVID media briefing. Our Shira Matsuzawa listened in on it earlier. She joins us now in studio to walk us through how the department reached this decision. Shira.
Well, Morgan, Health and Welfare Director Dave Jeppesen made that announcement at the start of the briefing, which ended just about 40 minutes ago. He says the Crisis Standards of Care Activation Advisory Committee met this morning and recommended that deactivation based on lower hospitalization numbers and a stabilization in staffing and blood supplies. Now, the advisory committee is made up of hospital administrators, healthcare professionals, and state agency representatives. And just a reminder, crisis standards of care means people may get medical care that is different from what they expect. It's now deactivated in Southwest District Health, Central District Health, and South Central District Health. Director Jeppesen said, to be clear though, even though things are improving, this does not mean we're out of the woods. COVID-19 cases statewide and the testing percent positivity are still very high.
It is important to note that healthcare systems across the state are still very stretched, with many using contingency operations, which is one step below crisis operations. This means that it will be some time before healthcare systems return to full normal operations.
Today's state epidemiologist, Dr. Christine Hahn, also explained in more detail what it means to be immunocompromised. She says it refers to folks who are people who have cancer or are on chemotherapy or have received an organ transplant. It also includes someone with HIV or dealing with lupus, among other examples. And with spring break just around the corner, health officials are urging folks to not drop their guard. They say get vaccinated and continue to wear masks. You can also get free KN95 masks by calling 211 or by contacting your public health district to find out where those mask distributions are happening. Morgan?
Yeah, Sharon, I know they touched on this during the briefing, the fact that cases and positivity rates are still so high. It's not time to drop our guard just yet.
Right. In fact, they were saying we're still at 25%, and that's 5 times more than what they'd like to see. So definitely don't drop your guard yet.
All right, Shira Matsuzawa, thank you.